Hey everybody, here we are. And my name is Eric. I'm a physical therapist. I enjoy running a lot, and I enjoy serving the running community a lot. And today is my first webinar. And I think I want to start by just talking a little bit about Juneteenth. It was interesting. My wife and I saw a movie yesterday called Hidden Figures, and unbeknownst to us, I didn't know what exactly the date was of Juneteenth, even though it was the 19th, it was yesterday, and we just happened to watch it last night, and it was probably one of my favorite movies of all time. And if you're hopping on, go ahead and, if you can, let me know you're here so I can chat with you. Comment live or comment replay. Hey, Angel and John, good to see you guys. Anyways, I thought it was space exploration is like my big deal. I love what Elon Musk is doing and SpaceX, and I love that movie last night. I had no idea it was. Hey, Angel, thanks. Jessica, thanks. Appreciate you guys all hopping on. But I just wanted to shout out to probably one of the three most important ladies that seem just to get us into orbit. And I don't remember their name. Katherine Johnson, Dorothy Vaughan, and Mary Jackson. Those guys, unreal, man. I really enjoyed watching that movie last night. I've been wanting to watch it for about 5-6 months now, really strong. And then it had like almost 8,000 reviews, and they were all 5 stars. So anyway, Calvin, what's up, bro? Scott, Danmar, John, Heather, awesome. Anyway, let me get into my story here. And it was called Hidden Figures, Angel. It was fantastic movie about history, particularly about just, Hidden Figures. These 3 ladies didn't get hardly any fanfare at all back in the day when they were in the working with NASA, and they're all African American ladies. And without them, it would have been a very long delay, very likely, in getting to space and getting our first astronauts to orbit and figure that thing out. But anyway, it was a fantastic movie. A lot of great stuff in there, a lot of great history that people just don't know about. And I certainly didn't until yesterday, which happened to be Juneteenth. So anyway, it was neat that it happened to work out that way. So yeah, let's just kind of, all that being fantastic, let's just dive into why we're all on here. So yeah, my name's Eric. I'm a physical therapist. I enjoy running and I enjoy treating runners a lot. And back in the day, I used to make orthotics all the time. Then I realized that making orthotics really wasn't that big of a deal anymore, unless there's like a really big problem with the foot. You can get a lot over the counter now. And they're a lot cheaper. You don't spend like $200-300 for these things. They're just like, 20, 30, 40, 50 bucks. They last for the duration of the shoe. And if you run a lot, it might not, last for more than maybe 300 miles, which could be a couple months for some people. Anyway, so my big thing about running and about injury prevention, injury treatment, particularly for runners, everybody, gets involved in this thing. But I repeat myself a lot because of something that I pick up on a lot in the clinic, and it's how the peripheral nervous system can become a pain generator. And it doesn't have to be because of the back. The back can be completely uninvolved, but the nerves can be pain generators, and it happens a lot. And not many people talk about this. And when I talk to some people, back in the day, maybe 5-10 years ago, and I started kind of feeling this stuff out. Oh gosh, you can hear my music. Let me turn it down. Thank you. Thanks for saying that, John. I didn't even hear it. Thank you. Wow. All right, there we go. Thanks, John. Thanks, Mom, for saying that too. Anyway, so yeah, so what I pick up on a lot is the nervous system as a pain generator. And I would get, when I started really exploring this stuff about, probably about 10, close to 15 years ago, I started getting a lot of deer in the headlights look. Like you guys, when you guys have this problem and people look at you and they're like, what? Like they don't really kind of understand what you're talking about. Or if you talk to your physicians, that you see they just kind of like, they give you that kind of like deer in the headlight look, kind of blank stare, can't bounce off of what you're saying because they have a hard time engaging, understanding it. And the nervous system is weird when it becomes a pain generator all on its own. And like I said, it does not have to be because of the back. And I think the low back, I think it ends up being the kind of the elephant in the room that nobody, talks about because they don't consider it that much. I mean, it's supposed to be this communication between all the other tissues, brain to your body, body to your brain, but it becomes a pain generator, and it happens a lot. So anyway, when I got out of PT school, I wanted to get back into running, and I started running a lot, and then I had a little bit of information, and I started stretching out my hamstrings, and I, like we all do, with your legs straight out in front of you, and I started feeling it in my calf when I'm stretching my hamstring. And I know enough to know that I'm not stretching my calf, but I feel it in my calf. So I thought, well, maybe it likely is the nervous system then, right? Because there's nothing that goes from my hip all the way to my calf unless it's a nerve, artery, or vein. So I started flossing the nervous system a little bit and fairly aggressively, not knowing what the problem was. Kind of feeling that it was the nerve, but when I did it way too aggressively. And I had pain in the back of my legs for the next 2.5 years. And my stride length, when I would do my running back then, it went from about a 7.5 minute mile pace to a 20-minute mile pace, because every single time I'd throw my leg out, I'd get a zing down the back of my leg. And every time I'd be done, it'd be achy all through my hip, my thigh, my knee, my lower leg, sometimes my foot and ankle. And so it just started not to make a whole lot of sense to me. I started to wonder what in the world happened. So I started on this journey to try to figure this stuff out. And, thank God for this place called the Neuro Orthopedic Institute, because without them, I wouldn't have even started kind of exploring the stuff. So anyway, but long story short is that I got over it, right? I don't feel it anymore. As I started to get into this stuff, and a key thing, and I say this mantra a lot to my patients. Mantra: movement, blood supply, space, and slack. I did a live, or did a post about that not too long ago, because your nerves respond positively to light movement, more blood supply, and ice might make it feel better for the short run, but ice tends to make it numb it up, but then it comes back. Movement, blood supply, and the two big things are space and slack, which is position modification in just about everything we do. Whether you're sitting, whether you're lying down, whether you're standing. And it just ends up being kind of a big deal. And the medical community just doesn't really know about this stuff. Let me get out of my own way here just a little bit. I'm starting to use this thing, but so bottom line is I'm gonna try to write on here eventually, but it just, they don't know about this stuff, the medical community. I have a couple notes if you see me reading off here. So really the fact that you're not getting better sometimes isn't your fault. It's because it just doesn't get talked enough. It's not in mainstream, and it's something that I just need to get out to you guys. But so what I did to help out along with this thing is that I did write a book. The cover, I'll show you guys the cover in a little bit. Brandon, the guy that did the cover for me, just sent it to me, and yesterday. So I was pretty excited, and it's about done. But I'll show it to you towards the end. But what I did, I made the book, and it's about self-assessment and self-treatment tips. Over the 20 years almost I've been a PT, some of the stuff, and it talks a lot about the nervous system generated pain that nobody talks about, that I know you guys are dealing with. And so it'll be fun. Anyway, yeah, and I got over it. You guys can get over this thing too, but you have to, when it's not like a clear-cut tendon, muscle, bone, ligament, and it's just, it's hazy kind of, sometimes it's on, sometimes it's off, sometimes it's there, sometimes it's not, sometimes it moves around, and sometimes you just can't figure out why it shows up again when it wasn't around for a while. That generally is the nervous system. When the nervous system becomes a pain generator all on its own. And yeah, so, and what would be cool if, I'm kind of wondering where everybody's from. So if you guys can just kind of put on there where you're from. Sometimes I've been talking to people all over the States, and sometimes all over the countries, all over the world a little bit. So go ahead and pop in there, and if you could, I'm interested. It'd be nice to see where I'm reaching and being helpful. But anyway, so this is what I'm trying to do. I'm trying to help guide you guys through this thing, and our Western kind of medical model just most of the time doesn't help with this stuff. They tend to go with the pills, injections, and surgery. Awesome. Gastonia, no kidding, just south of me. Awesome. New Hampshire, Massachusetts, Aiken, South Carolina. Hey, John, awesome. Good to see you guys. But yeah, so there's a tendency, and this all happened probably about maybe 25 years ago, when the gatekeeper, you always had to go through a gatekeeper to go anywhere, and the gatekeeper generally had maybe a lecture or two of physical therapy or any kind of conservative management specialist. They just didn't have any understanding of it, and so they really didn't know if you would get helped by it. But what could they do? Well, they can give you pills, injections, and surgery. That's kind of how the whole Western medicine kind of culture got really the wheels started to really turn really hard back in, I think it was the 80s, 90s, early 90s. Might have been earlier than that. But anyway, so and so sometimes we don't know that we can actually go to somebody without going to the doctor first and getting a referral. Some of it now, the APTA has done some hard kind of work and made it so that just some of the state PTAs actually have, for some insurance, you have access to go to PT without a referral now, most of the time. Unless it's like commercial insurance, or unless it's like Medicare kind of stuff. Yeah, so I kind of want to break out of that, and go straight to you guys, because a lot of you guys don't know that you can do that, number one. And number two, I'd like to target runners because those guys value what I have to offer. Sometimes when you have like zero, skin in the game, and you're not really very motivated, and the runners are generally pretty motivated, and they'll listen to what you're telling them, and they'll go right after it. Sometimes I just feel like I'm talking to a wall when I talk to some patients, because there's just, maybe no value perceived. But I know you guys perceive value here, and thanks for coming on, really. Hastings, up in Bakersfield, back in Cali, awesome. Venezuela, Awesome. Toronto, yeah, NYC. I see you, Vernette. Awesome. Good to see you on here. And yep, Hidden Figures, awesome movie. Loved it. So what I'm going to try to do today, I'm going to try to kind of exchange kind of some questions here. I want you guys to ask me questions. I want to kind of over deliver in what I'm trying to offer you guys, and just make it something worthwhile for your time. So something interesting. A couple of I'm going to try to share like a couple of decades of what I understand about hamstring, IT band, high hamstring pain. I think someone mentioned, a couple of people mentioned high hamstring, like right at the ischial tuberosity where it originates. Hip pain, butt pain, and bursitis. Yeah, let me tell you something interesting about bursitis. Bursitis will normally come on when there's and you'll notice it, because have you ever seen like a really fat elbow with a big old ball at the end of it, or the same thing for the knee? That's generally what a real bursitis looks like. And so unless you have like a real gushy feeling on the outside of your hip, most of the time that's not bursitis, in my opinion. But that's the default kind of way to go about it when there's a diagnosis sometimes, because most of the time people don't think about the nervous system. IT band isn't, it's another thing that, goes down the outside of your leg, and people keep rolling on their IT band, and maybe it feels better for a while and just before they run, but it just never feels like it's always tight. It just never goes away. Most of the time when you stretch something, you get length out of it. If you're going to stretch out a muscle, you're going to get length out of it, over time as the weeks go by and the months go by. If the IT band continues to feel tight all the time, most of the time, again, in my opinion, I don't think it's the IT band. Now, that's my opinion again, but that's just what I see almost all the time when I test out the nervous system and I move the foot and I make the IT band pain turn on or turn off. I make the hip bursitis pain turn on or turn off by moving the foot up and down. And that's after I put the foot in a position where they feel the pain just a little bit, and I put the whole leg, just a little bit modified of knee bending, hip bending, foot stuff, turning the leg in just a little bit, and you start to feel maybe a little bit of hip pain. Well, then I'll move the foot, or a little bit of hip pain. I'll move the foot, and that'll turn on or turn off the pain in the hip by moving the foot. And I did that in front of a physician one time, and it's kind of because we had like a joint kind of a eval with, it was sports medicine night one time. And I just, and it was a diagnosis of bursitis. And not saying it doesn't ever happen, but I think it's overcooked as a diagnosis, in my opinion. So I just did what I normally do in the clinic, and I bent the hip up, I straightened the knee mostly, then I unbent it, and I moved the leg over, and I moved the foot a little bit, and I turned her hip pain on and off by moving her foot. And we all just kind of looked at that and said, wow, that's interesting. Again. But anyway, Ryan, no way, dude. Good to see you, man. Really good to see you. How you doing, bro? Debbie, thanks for hopping on. Will, Stacy, thanks. Bob, awesome. Good to see you guys on here. And of course, Burnett, awesome. Anyways, though, what most people don't talk about is the sciatic nerve. It is the elephant in the room, along with the entire nerve matrix that goes down your leg, and most of it. It's about the size of your thumb. You look at your thumb, that's the nerve, your sciatic nerve, going down the back of your leg. And this is how I think of it clinically, maybe this will help you guys out too. When you when you think of like a pain in your leg, just understand that everything down the outside and back of your thigh and everything in your lower leg down to your foot comes from a branch from the sciatic nerve, because it's that big. It innervates nearly the entire lower leg. And so it ends up being a pain generator, or it ends up, if it's not real nice, if it's not real happy, right, it'll set up the environment down your leg to be a little bit more irritable, whether it's in your knee. Generally, it'll start in the hip, knee, foot, and ankle. Sometimes it's the hammy, sometimes it's the calf. Calf strains, I'll say something about calf strains. Calf strains generally don't happen, all right, unless it's black and blue. But if it's lasting for like, 3, 4, 5 months, most of the time that's not a calf strain. That's the tibial nerve coming off of the sciatic nerve. And stretching it generally doesn't make it feel better. In fact, it makes it stay around and maybe make it a little bit worse. Might be intermittently better right after the stretch, or feel right. But generally, it's not doing you a good job. Anyway, yeah. So when and the nervous system, when it's irritated, there's sometimes not a real clear cut kind of a solution. It comes on, it comes on and it turns off. I mean, you could be sitting down and minding your own business, and it starts to get painful. Or you're sitting down, really not doing anything, and then you move your leg to try to get up, and it feels awful. You just simply, you put your foot or your leg, right, up on an ottoman or whatever, right, just kind of reclining and minding your own business and thinking everything's fine. And then you go to move, you stay there for about a half hour, and then you move your leg, and you feel it down the outside of your thigh, down the back of your leg, in your hip, sometimes in your back, sometimes on the outside of your hip, sometimes in your butt. Sometimes just simply sitting down causes it to get irritated. Like I'm sitting down in this chair right now. I'm just sitting down in this chair right now. It just tends to slowly kind of kick up and get worse. Right on your ischial tuberosity or right in the back of your hammy. Let's see, John. Boom, that's very good, John. Yeah, I mean, it's like and particularly the hamstring stretches. Well, I was talking about keeping our legs straight and going down. Well, that's exactly how I started the zinging down my leg for like years. I just did that for 3 days, and all of a sudden, when I get out of the car after about a 45-minute drive to work, it hurts. And I have a hard time getting out of the car all of a sudden. I'm wondering, what in the world did I do? Anyway, it kind of comes up that, right? Okay, Heather, so I have herniated disc. L5S1, pain was on the left side of the hip, down to the leg. Got pain management shots, but still have issues when I run in the left leg, left hip, hammy, and left knee. Sometimes stretching makes it worse. Exactly. And stretching in the long run, in my opinion, Heather, tends, particularly your hamstring, if you're stretching your hamstring, generally makes it feel worse. It won't make it, it might make it better for a short amount of time. But then after a while, it just doesn't. It makes it actually hang around for a little bit longer than it needs to. The only stretch that I actually recommend to anybody that has hip or hamstring tightness or pain or tightness or soreness or achiness, whatever you want to call it, the only stretch that I offer that I ever suggest is simply a piriformis stretch, but that's on your back. Okay, so you can, if you see me sitting here, and let me just go ahead and do it on the ground. So it's the same look when you're sitting or lying down. Yeah, so anyway, so it's just this stretch, all right? I'm lying down. I'm either bringing my knee towards my opposite shoulder, or I'm going up towards it. Or if you really want to get a good stretch, I would not suggest that yet. You can get your other leg, right? And you can bring it up. That's almost too much most of the time. And what I always add to the stretch is a little bit of an oscillation. If you can see that, it's a piriformis stretch, but it's with a little bit of an oscillation because the nerves like motion. They like movement. They like movement. If you keep the stretch on and you leave it there for 30 seconds or a minute, it intuitively feels right because you feel tight, right? Or you feel sore, or you feel like it's the right thing to do, or you feel it in the right place. And it's like, you know, it seems like it's right, but it's wrong. You know, I mean, intuitively, it's just very strange. Anyways, good, yeah. So most of the time, I'll have people do that, and I'll ask them to do it. That piriformis stretch, I'll say, look, you know, it's worthwhile just to get 30 seconds every hour, every 2 hours. Just get 30 seconds in there. If you can sit down and unload that side and not be sitting, I'm stretching my left side right now. So if I'm off of my left butt cheek and I'm stretching it, I'm not killing it. I just feel the stretch and I oscillate it. So I'm off of my left butt right now. I'm stretching my left. So I'm kind of off, right? I'm stretching it and I'm oscillating it. You know, first just 20, 30 seconds at a time. You know, every hour, every 2 hours, because the sciatic nerve and the piriformis muscle are tightly together. They both kind of have a party. If you look at the internet and you just look up piriformis muscle, you'll see how close the piriformis muscle is to the sciatic nerve. And when one is tight, the other one gets irritated. And when the other one's irritated, the other one gets more tight. And so it just ends up being this back and forth they have with each other. Angel, yeah, so post-run stretch or pre-run? Post. Yep. It used to be, that's a great question. It used to be, you know, stretching beforehand, just a dynamic warm-up. You know, sometimes you'll just just grab onto the side of your car, your trunk, or, you know, a truck or a bar, and just kind of swing your leg. You know, just light. Just kind of a light, kind of a just, you know, just, you know, sometimes people go into maybe, you know, 20 seconds of lunging, right? They'll go on the ground and I'll just, you know, put one foot in front of the other and just do a lunge. Motion is important for pre-run. You don't need to stretch. So post-run, trying to gain length, it's probably going to be the best time to gain length at that time. But again, I would suggest no hamstring stretches if you guys are dealing with hip pain, dealing with hamstring stuff, dealing with pain on the, you know, your ischial tuberosity, dealing with even pain in the back of your knee when you're, and, you know, pain on the outside of your thigh into your IT band. Now, the one time, you know, and this is good to be nerve too. It's hard to figure it out, but that's why I wrote a book. Anyway, generally there's a really sharp pain right here. And that's called IT band friction syndrome, right here, right over the outside of your femur. Anyway, that's when it's a pretty clear-cut IT band. But when you have this pain on the outside of your thigh over and over again, and you keep rolling it, you keep stretching it, and it doesn't quite get better, it keeps hanging around, and it might get, if it's not that bad, it might get okay, you know, and deal with it. But if it keeps hanging around, that's when I start thinking, no, it's probably not nerve. I mean, it's probably not IT band, it's probably nerve. Hope that helps, Angel. Anyway, let's see here. Yeah, so this is what I suggest. Stop stretching your hamstring. My suggestion. Stop stretching your hamstring. Stop stretching your IT band. For now. And just, you know, give it a couple days to a week and just see what happens. you think it's the right thing to do. And some of you might just, uh, you know, might just feel like it's you just do it because you've always done it. But chances are you're probably making things worse. Let's see, Jessica, I very rarely stretch, but I see an excellent massage therapist who works on my glutes almost 15, 20 minutes each side. And then she talks a lot about IT and sciatica. Yeah. Glad, oh, awesome, Heather. I'm glad it's helpful. And Jessica, yeah, stretching really doesn't do a fantastic job most of the time. It's a little overrated to a point. I mean, there's value to it, but when we start having pain in our hip, particularly, or down our thigh and our hamstring, it tends not to be the best thing to do. In fact, I really strongly encourage people to stay away from stretching, unless it's your piriformis and unless you're supine or on your back and oscillating it, or you're sitting completely unloading that same side and you're still just kind of oscillating it. And don't kill the stretch, just feel it. Just want you to feel it, that's it. Let's see, yeah, so, yeah, and going back to what Jessica said, the thing about the nerves is that you can be sitting down, you could be maybe, you know, with your foot propped up on the ottoman, like I said, you know, you can be in a recliner. Maybe you lie down on your, maybe you're a side sleeper. Maybe you worked out in the garden a long time and you tend to stoop forward from your hips. But that's just how you move around. Or maybe you were in a long kind of a lunge position, you know, over your knee for a while you're doing something. And maybe you've had some on and off low back stiffness, tiredness, tightness, pulling, stretching, whatever you want to call it. If any of us wake up with low back, whatever, we shouldn't be. Right? If you want to, it's not normal. I know that, you know, we all feel like we all supposed to have back pain, and it's like, no, not at all. We're not supposed to have back pain, you're not supposed to feel your back. It's kind of like feeling your nose, you know, when you wake up in the morning, or you feel your eyeball, right? Of course, you might have some sleep in it, but I mean, if you get what I'm saying there, it's unless it's a pain generator, and unless it's in pain, or unless you're touching it, you shouldn't feel it. You should know it's there, right? I mean, I know where my foot is right now, but you shouldn't be focused on it. And you shouldn't, I mean, I shouldn't even said, you know, it's there, because some people say, yeah, I know it's there, and they're really talking about pain or some kind of symptom. It's just not normal. Anyway, let's see, Lisa, just saw my sports chiro. I have a pain in my left hip area that he said was not a hip problem or a muscle. He did active release on me and said he was flossing the nerve that runs and creates friction when the muscle and fascia get tight. Are there any exercises for this? Have you heard of this? Yeah, I mean, you floss the nerve. That's, there's variations of flossing it. And there's ways to floss it. Now I stay away from it almost completely, because that's what I did, and I had pain down the back of my legs for like years, a couple of years. Really bad for about 3 to 6 months, but I couldn't ride my bike unless I was off the saddle. I couldn't ride my bike for a couple of years. Anyway, and without knowing like where, but I'll say it again, most of the time, it's pretty rare to strain your hip muscle, whether it's on the outside of your hip, the back of your hip. Sometimes you get a strain in your ischial tuberosity. That does happen. But anywhere down the outside of your hip or your big glute, it's pretty rare to strain that. So any pain generating from there, in my opinion, most of the time, not all the time, but most of the time, is the is a branch coming off of the sciatic nerve, and your sciatic nerve has just probably been irritated for a while. Hope that helps, Lisa. But the stuff that we're going to talk about at the end of all this is going to like hit you. If you do what I'm going to talk about and you end up feeling better, chances are it's the nerve, or the nerve is a component of it. I do 2 hours of heart rate yoga sessions. Hot means heart rate or hot yoga sessions a week. Sure, Lisa. On days I'm not running, with lots of down dog, hamstring stretches. Is that okay for runners? If your legs are straight and you're stretching your hamstring, I am not a fan. I'll tell you that right now. Unless you were, pretty upper level, hour long. Okay, 2 hours. Okay. Unless you were considerably more flexible back in the day, like gymnast, or dancer. If we have hip stuff going on and down our leg, down the outside of our leg or the back of our thigh, I stay away from hamstring stretches with the leg straight. Never do it. At least for the time being, until that symptom completely resolves and is never around again. But still, I would never straighten my leg to stretch out the hamstrings ever. Let's see. Wow, trying to keep up here. Let's see. So, yeah. Let's see. Thank you. Yeah, hour long. Okay. Denise. I've had chronic hamstring tightness for years, and I could find no relief. Long runs, I would feel terrible. Hamstring tightness, yeah. Pelvic pressure, yeah. Finally getting some myofascial release therapy to the pelvic floor seems to be working. Wondering if there is some way to strengthen the pelvic floor. Yeah, I mean, one of the best things you could start doing is probably drawing in your stomach a little bit and keeping it there. It's a really solid connection point between your rib cage and your pelvis, and a place where transfer of energy can occur. If that muscle's not active much at all, then there's not a very good transfer of energy from your legs to your body when you're trying to go back and forth when you run each stride after each, and that's why you opposite arms and stuff. Yeah, so when you have chronic hamstring tightness for years, that's a strong indication to me that the sciatic nerve's irritated on both sides. Very strong indication sciatic nerve is irritated on both sides. Yeah, so I'm glad you're getting some help with that. But when you have chronic hamstring tightness, there's no reason for that, because the anatomy, when it's unless you've strained your hamstrings on and off, and then you have connective tissue problems, and you have some swelling and scarring to take place, and that could be something that going after this. But most of the time when I see it, when there's chronic hamstring tightness, if the sciatic nerve isn't the problem, it's involved almost every time when I see it, because it's massive. It goes right down your hamstrings, and it's the size of your thumb. Anyway, let's see. Thanks, as always, from Greenville, North Carolina. Please post save afterwards. I have to go to new adventures. Awesome. Glad to help, Tim. And Tom Brown, Kimberly, thanks for you guys all coming on. I'll just tell you guys some stories, I guess, right now. I mean, instead of just about me and how... So I started going down this road about nervous system generated pain. One guy came to me with an elbow strain, right? Actually, it was post-op. He was 8 weeks post-op. We call it lateral elbow release, right? So he had lateral elbow pain for a long time. And if you guys look at the anatomy, radial nerve goes right there. So I don't know what happened beforehand, but he had a release, supposedly to release something. some kind of connective tissue or whatever. And 8 weeks post-op, he's pretty gunked up. He can't, his pain is still there. And so I asked him to do what I say is what is a radial nerve kind of a test. And I have him kind of just turn on his pain just a little bit. And he's on his back, right? And this is my right arm. And I go to his left leg and do what I call a straight leg raise, or like a really bad hamstring stretch, which involves your sciatic nerve. And I made his right elbow pain get worse. I move his left leg and his left foot. So when I moved his left leg, his right elbow got a little bit worse, but then I moved his left foot and his right elbow pain got worse. I turned it on and turned it off by moving the opposite extremity on the other side and his leg, and it made his right. That's when I started to notice that the nerves are really connected in a pretty big way, and can turn on and turn off pain in other parts of the body. It's really fascinating because it's this massive neural matrix that communicate. They all kind of, they all kind of know what each other's doing. There's a guy that came to me with plantar fasciitis, right? You might know some people, I'm sure. There's a Facebook group of almost 20,000 people. Plantar fasciitis on the bottom of the heel. He came to me, he had it for years. And he saw everybody. He saw his general practitioner, he saw his family practice guy, I guess he saw a chiropractor, he saw an orthopedic specialist in the foot and ankle, and he saw a podiatrist. Yeah, he saw a podiatrist. And when you see all these people and it's not getting solved, then I start thinking, that's the first thing I go to. So I asked him if he's had any kind of hip or hammy kind of tightness or pain or soreness. And he said, yeah. So I do this straight leg raise test on him, just like the guy with the elbow. And I move his foot to turn on the heel pain a little bit. And then I keep his knee straight and I move his hip. And moving his hip up and down, or moving his leg up and down from his hip, was turning on his heel pain and turning off his heel pain. So I worked on the guy's hip, and he feels a ton better. Took like 2 weeks. Yep. Anyway, he had it for years. That was a long time ago. I can't remember what exactly I did, but I know I worked a ton on his piriformis. And you have to be careful about that too, because if the sciatic nerve goes right around the piriformis, so I work on either side of it. I work on the place where it originates in front of your sacrum, your tailbone, and the place where it inserts on your hip. I kind of stay away from the middle third where the sciatic nerve kind of is. And then there's a gal that came to me and she sprained her ankle playing with her kids, and she thought 6 weeks goes by and she feels better. And it doesn't go away though, right? And it's all of a sudden when you're not in your teens and 20s, things just don't go away like they used to. And so a month and a half has gone by now, and she can't run around with her kids and play soccer. They're both boys. She's a stay-at-home mom. She's trying to, do the best she can to keep up with them and have a good time. And she can't, because at times now, as another month has gone by, it's like an 8 or 9 out of 10. And so she comes to me for a session or two. It's still really bad. And so I said, well, I'm going to send you to a guy, maybe take an MRI of this thing, see if there's not anything floating around in there that wasn't seen on the x-ray. But if it's negative, come on back. And so this is like one of the best guys in the area. Like, I asked all over the place to make sure that I send her to the right place. And he's really good. One of the best trauma surgeons for the foot and ankle around. And he gets the MRI, and of course it is negative. And he says, well, we could go in there and do some exploratory surgery. And she told me that, and I said, come on back. Don't worry about the surgery. Come on back. Let's do stuff. And so I treat her foot and ankle, and I go up to her. I work my way up past her knee into her hip. And then I get, talking about her hip. She had any hip pain? And yeah, her too. Hamstring tightness, chronic stuff. So work on the hip. and the foot and ankle pain almost completely subsides. And you know, when we go to people and all they have is a hammer, you're gonna look like a nail every time, you know. And most of these guys still nowadays, they get maybe a lecture or two of an hour or two of what conservative management specialists can offer the medical community and, treating patients and the healing arts. So it's still kind of too bad. But everyone wants to go to the physician to feel better because they got the pills and injections, but things generally aren't solved. It's almost like a train wreck down the road leading towards surgery when the problem isn't solved biomechanically, or at least neurobiommechanically, like we're talking about here. So MRI, negative. Still has a lot of pain. What do? Exploratory surgery? If I wasn't there, she probably would have had it. And then what? Nerves get irritated. You might have taken out some tissue. It's just, I feel like this stuff that I need to share. I need to share with you guys. MRIs are probably the best and worst thing that ever happened to the medical community, particularly when it comes to backs. You start diagnosing things by looking at MRI, and you look at things and what you think is the pain generator isn't. And so you do surgery on it, and pain doesn't go away. I get it. I felt kind of the same way, when I first started dealing with the pain that I was dealing with. When you have stress and anxiety, that increases it. And you can't exercise, that increases the pain. And really, to be honest, if it's just winking at you a little bit, don't let it. It's probably getting a little bit worse. Anyway, so this is where I start talking about movement, blood supply, space, and slack. And I need to talk about this stuff. So for an example, I'm going to ask you guys this, if you're not in your car. If you're in your car, don't worry about it. But if you're able to stand up, do this test. This will be pretty interesting. Let's see here. So if you're standing, just try to bend forward, right? And try to touch your toes. Stay there for maybe a second or two, right? And then come on back. Just stay there a second or two and come on back. What I'm going to ask you to do now is just kind of, I don't know if you can see it, but just kind of, all I'm doing is just moving my knees back and forth. Just do that for maybe 15 seconds. You do that 15, maybe 20 seconds here. And do. Yeah, so it's probably a little bit better. And then I go down, and you'll be surprised how much farther you can go. So I'm curious, if anybody did that just now, let me know if you did. And if you got a little bit farther. Because, it's body dance. But if you do that, you'll notice that, I'm curious if anybody did that. If you didn't, go ahead and try it while I'm still talking, because I like to know if you got farther. Because what it demonstrates is that there's nothing wrong with your hamstrings. There you go, Lisa. Yep, there you go. Thanks, Mom. So with that, I could get a little farther. Yep, every time. Yeah, so what that demonstrates is that you didn't stretch, right? It had nothing to do with the hamstring. All you did was move. And there's like movement. Anyway, it's a little eye-opener for a lot of us most of the time. Yeah. Way to go, Thomas. Yeah. Yeah, most of the time, Angel, about every time, you know, maybe 20, 30 seconds. You know, go ahead and, you know, go for like 30 seconds. Just know that you're not stretching, right? Know that you're not stretching and you went farther. It's not your hamstring. It's your nerve. Anyway. This is... My wife might be able to chime in on this. This was very interesting. When we were hiking and we were going down the hill one day, and I've kind of, you know, I look at the anatomy of the back and hip and legs and stuff like that. Let's see. I did swim today. Does that swim kick help? I felt like I could feel my swim muscles when I did that move. Yeah, a little bit. Sure, if you already swam. But generally, if you do this for at least 15 seconds, you know, maybe double, but no more than 30. Trudy, yay! Trudy, so good to see you. Oh my gosh. Like a blast from the past, man. So good to see you. Hope you're doing well. And your daughter, I hope you guys both are doing well. Really good to see you. Yeah, Desi. Anyway, tell her I say hey. But yeah, so anyways, then Audrey, thanks for watching. Good. Awesome. Hey, if you don't mind, Trudy, instant message me your phone number. I want to give you a call, man. Just say hey, see what's up. Be cool. But anyway, so what else was I gonna say? Well, yeah. Anyways, oh yeah, I was gonna talk about my wife. Yeah, so we were hiking and she felt some knee pain in the front of her knee. And this is another thing that I do. Thanks, Trudy. So I asked her to draw her stomach in while we're hiking. And we're going downhill, and I asked her how her knee felt, and she said her knee pain went away. Isn't that right, honey?
Yeah.
So, I mean, it's like the elephant in the room that nobody... And so, okay, so let me just try to explain what I think was going on. When you draw your stomach in, your lumbar spine has to flatten out a little bit more. So what I said originally about your back doesn't have to be involved. Sometimes it is. And sometimes what the nerves just really like is that they like a little bit more space. Like I mentioned before, they like space. And so when you draw your stomach in, you flatten out your back a little bit. You take it out of that really excessive lumbar spine extension, sway back kind of look, and you draw it in, and you offer your nerves, as they exit your lumbar spine, a little bit more space. So, and you actually make a little bit more streamlined direction from the nerve, from the back all the way down the back of the leg, back of the hip. It doesn't have to take a hard angle around your hip, excuse me, as much. So I gave the nerve some space, and I gave it a little bit of slack when I asked her to draw her stomach in, and her knee pain went away. Interesting. A lot of people aren't talking about this. That's why I got to get it out there to you guys. Anyway, hot shower, right? If that makes it feel better, chances are it could very likely be the nerve. You wake up in the morning, you know, you feel a little stiff. You have a hot shower, your hips feel better, your IT band feels better, your hammy feels better. Could be the nerve. Like I said, like ice numbs it up. Awesome, Lisa. That is so cool. Yeah, it is. It is pretty cool. So let's see what else I could tell you. Yeah, the tape, the rock tape. Let me get to the rock tape. That's something that you guys need to know about. So right here, I got some rock tape. It's backwards, but it's rock tape. You can use Kinesio tape. You can use TheraBand tape. You can use, I think there's KT tape. There's like half a dozen or a dozen now, different brands. Just been using rock tape. TheraBand's pretty good too. Anyway, so I'll show you with my, you can do this on the IT band. You can do this around the hip. You can do this at the hamstring. And I'll show you with 2 strips, and you can make this longer, right? And I'll overlap these strips by about half. But I'll only use like 2 strips just to give you guys a general idea, not waste your guys' time. But anyway, so yeah, hammy right here is generally where your sciatic nerve runs. Okay, you can do this at your butt too. I just won't flash everybody my butt today. I won't do that at a later date either. But right along through here, you can apply the tape exactly the same. Exactly the same. So I take off about maybe the first, about 1.5 inches-ish. I'll apply it. Now this is for someone that has, you know, a hamstring problem, right? IT band, just do it on the side. Right on the side. And overlap maybe two more times, so by half, right? This is about 2 inches wide. So I have about 3 strips, and all 3 of them will be overlapped by half. So lay down the first 1 or 2 inches, and then stretch out. The middle portion, and then lay down the last half, right? Or last maybe 1 or 2 inches, sorry. So that's laid down. That's laid down. This is stretched out maybe 50-75% of what the tape can offer, right? Take another piece. Same thing. Overlap it by half. About, doesn't have to be perfect. And then you stretch out the middle third. And lay down the last, well, the middle portion. And you lay down the last little bit. I stretch that one out just a smidge more. And then maybe put another one right here, right? Or right there, depending on where your pain point is, right? If your IT band is a little more irritable, then you migrate it up towards the outside of your thigh. If your butt's bothering you, then you bring these 3 strips up towards your butt. Same kind of principle applies though. Same kind of thing. If you do that, you guys will notice pain relief nearly instant. Not kidding. Nearly instantly. And the one that was, let's see, all you guys that have hammy, IT band, butt stuff going on, even your ischial tuberosity, where it inserts right there, do that. Go get some. Generally, you can buy it online. You get a big, massive roll. Some of you guys probably need it, but excuse me, it's about 105 inches long and 2 inches wide. But generally, your CVS, Walgreens, or Rite Aid. Yep, thanks for hopping on, Burnett. I'll see you later. Yeah, so it's called KT tape in athletic footwear or athletic like Sports Authority, CVS, Walgreens, Rite Aid. It'll have KT tape. And it's the colored stuff. It's the athletic tape that got a lot of fanfare back in the China Summer Games when there's beach volleyball. Yep, got a ton of fanfare then. So yeah, the rock tape's going to be helpful. Space and slack. Okay. Position of comfort is huge in trying to get this stuff to feel better. It's huge. Light exercise. not sitting down exercise, but light exercise. Like maybe, hey Brandon, dude, I'm gonna give a big old plug for you, bro. In fact, I'm gonna do that right now while Brandon's on. This guy knows how to draw. He's amazing. And so this is gonna be, I'll show you guys. This is going to be, if it's right here, that's if I can zoom in on that. If I can zoom in, there we go. That's Brandon. He's awesome. It's almost done. If it's, I mean, I'd be happy with that, completely. Completely. Not to embarrass you, Brandon. Nothing embarrassing about that. That's like just awesome. I just love what you do. Yeah, so I'll tell you about the book later. But I'm just really excited about it. Anyways, so position of comfort is huge. We'll talk about it. Space, that's the piriformis stretch. Give your pore sciatic nerve space. It's really got to be gentle stretch with oscillations. And you can't sleep on that side anymore. All right, Heather. Awesome. Yeah, you can't sleep on that side anymore. You can't. If you have a left hip pain, you can't sleep on that side. It's hard. I get that. It's like kneeling down on it, and you have knee pain. You can't kneel down on your knee when it's painful. You just don't do it. Well, same kind of thing. You shouldn't do it for your hip either, or for your shoulder for that matter. You might not feel it when you're lying down, but you're not setting up the environment to be very successful with motion when you have to wake up and go to work or whatever. It's just not good. Most of the time, it can be traced back to something and some reason why you had it. Let's see. Let me show you what I show my patients. When you're sitting down, your knee should be a little bit higher than your hips. Your knee should be higher than your hips. So the front edge of the chair is not driving into the back of your thigh. Okay? Front edge of the chair, you don't want it driving in the back of your thigh. When you're driving, when you're sitting in your recliner, when you're sitting on the couch, when you're sitting on a chair in the dining room table, kitchen table, you don't want to sit down with the knee in the back of the thigh. Sorry, with the front edge of the chair driving in the back of your thigh. You really should have your knee higher than your hips, okay? It's going to decrease stress on the sciatic nerve. You're going to be on your tailbone a little bit more, and you'll be offloading or unloading that sciatic nerve a little bit. And don't use the ottoman with your knee straight. You're just stretching out that sciatic nerve. Bend your knee, okay? Bend your knee. Put your foot firmly on that, ottoman in front of you. Keep your knee bent and recline a little bit. If you're going to be in a recliner, go ahead and swing that thing up for your legs, but don't let your leg just kind of go up. Bend your knee, firmly plant your foot on that platform that swings up for your legs. Yeah, and you can't sleep on it. Not for now. It's just not going to be helpful. Let's see. And I get into a long kind of a dialogue with my clients for probably the first week or two, because it's hard to really kind of trace why it's painful. When it's not necessarily a tendon or a muscle or a bone or a ligament. When the nervous system's generating the pain, it's really hard to kind of trace. And it doesn't behave the same. There's a delay. There's a delay in how it responds. So, and there's this thing called a summation effect, meaning that you can be doing a lot of little things that irritate it, and none of them all on their own do anything. But there's this summation effect that makes it so that when you're doing something that seems relatively benign, and then all of a sudden you start having your pain, and you're thinking, why is that? Generally, that's the nervous system. And there's reasons. There's a reason why it's becoming a pain generator. And there's reasons why it's letting you know that it's hurt. Sometimes you just have to hash it out in a way that goes back to movement, blood supply, space, and slack. It wants light motion at least a little bit. It wants blood supply, which is motion, light exercise, and heating pad. It really, really likes space, and it really, really likes slack, long duration. That's why when you're sitting down, you can't sit down on your sciatic nerve, not for now. Unload it, bend your knee so it's not straight out on the ottoman. And when you're leaning back, you're not on your butt bone anymore, you're unloading and you're on your tailbone a little bit more. You're letting your sciatic nerve just kind of, instead of having like a really hard angle around your hip when you're sitting tall, it's just kind of this obtuse kind of an angle. It gives it some breathing room to go down your leg. And you can't sleep on that side. And if you don't sleep on that side, which is great, you probably need your knees and your feet separated by a pretty good bit, a pretty good margin. 4 to 6 inches maybe, at least, sometimes more. With your knees up, fetal position on your side, both of them. Not halfway on your stomach. And it does take a tremendous amount of consistency to make this stuff go away. So all the stuff we're talking about, you got to do a lot of it. You got to dose the system in this kind of stuff all the time, constantly, all day, every day. And if you give yourself an opportunity to maybe not do it, and you think, well, I can lay on my side for a half hour, an hour, there it comes again. It'll show itself up again, just like you didn't do anything for it. So, but you can get back to making it feel better again. And it just, sometimes it takes months. You'll feel better quick, but you just have to continue to do all of the things that make it feel better. So the one last thing that I'll show you guys, and maybe this will be helpful. So my markers, but hang on, didn't use any of them. Positions of comfort. With my legs up on the chair, if you can see that, and I'm lying down on my back. There you go. Legs up on a chair, lying down on my back, stay here for a half hour, 45 minutes, maybe even 2 hours. So if you see, with my knees and feet separated, and if I could be on my side that's not painful, and have my knees and my feet separated, I'm exactly in the position that you need to be in. So that's lying down, or that's lying down on your back. You can lie down on your side, do the same thing. It's a fairly similar position, just on your side with your knees and your feet separated. Not just your knees, but your knees and your feet. Okay. So, one thing I gotta talk to you guys about, I gotta plug in my book there. It starts with the foot and ankle lower leg. It's fantastic. About 20 years of working with foot and ankle lower leg stuff, and the nerve pain stuff is in there too, which is really important, I think. I talked to a gal that was, I forget where, but she pointed to the outside of her heel. She pointed right there. and she said, does anybody know what the problem could be here? And there, she posted in one of the running groups I'm a part of, and it's the only thing there is skin and bone and nerve. And we talked about movement, blood supply, space, slack, the taping job, and not lying down on that side, and making sure that, I can't remember if it's a right or a left leg, not putting a lot of pressure on the area, make sure your shoes aren't too tight. And, in about 3-4 weeks, it's all gone, and she's running and feeling better. So anyway, the book's called Tips Running Pain Free, The Guide to Master Self-Assessment and Treatment for Injuries. My podcast, I'm just going to start the first one today with a buddy of mine, with David Herzberg, Endurance Athlete Alliance. That's going to be exciting. And my Facebook group is Running Motivation and Training League. Love running, and love to help you guys out. So anyway, stack up pain issues. Stack up pain issues. What do you mean, Angel? Stack up pain issues. Is the book released yet? All the content's done, and it should be released by next weekend. At least the digital copy. I'm pretty excited. So at least the digital copy will be done by next weekend. And I'll keep you guys posted on that. I'm pretty excited about it because it's all about, and it really is, it's tips, running pain-free, the guide to master self-assessment and treatment for injuries. I feel like I need to go head-to-head, with the medical model that we're all in, and just give you guys information about this stuff, because it's so hard to come by. And it's pretty quick. It's a quick and dirty kind of a, it goes by region, right? So the outside of the ankle and foot, the inside of the ankle and foot, the front, the back. I do the same thing with the lower leg, the front, the back, the sides. And so it's kind of like a acute pain by body region. That was just what I thought you were talking about with multiple pain root causes. That was just what I thought you were talking about with multiple pain root causes. Yeah, there's that. It goes. It's stack up pain. Yeah. So it's like that's pretty good there. Yeah, too. I call it like a summation, like everything's summed up. There's a summing up of pain issues that cause, or summing up of certain areas or regions that are painful, and then all of a sudden you have a really bad pain. And it doesn't have to be coming from the back. Sometimes it does. If people have had on and off low back irritation, then you almost set the tone for the nerve to be slightly more irritable down the road, down your leg, if the back is already not feeling all that great, on and off, historically. Anyway, yeah, so that's all I got, guys. I was hoping to keep it to about an hour, maybe pinch over, but we're about an hour and 15. Sorry to keep you guys so late. It was nice to be able to interact with you guys, though. That made it kind of fun. Instead of just blurting the stuff out. Yeah, let me see if I want to make sure that I say hey to everybody. Thanks a bunch. You're welcome, Lisa. Margaret, thanks for hopping on. Ansenden, Lynn. Maybe you go by Lynn. You're welcome, Angel. And I want to pronounce that name right. Bunroth, you're welcome. Thank you. You're welcome. Yeah. Heather, she's off. Yep. How do I pronounce that name right? Is it Lynn or is it Ansenden? Ansenden? Ansenden. You're welcome, Denise. Yeah. We'll talk soon. Thanks, Mom. And you're welcome, Denise. Let's see where. Sulfariana. Sulfariana? Sulfariana? Is that how you pronounce it? Hey, Alex, what's up, bro? Let's see. Thomas, Jessica, Brandon. I hope I didn't embarrass you, bro, but you just do fantastic work. And I just wanted to show that cover that you just did for me, for people, for the book. And that's just, you're a gem. You're awesome. Anyway, Robert, Marsha, and Audrey or Adri, Jessica, Monica, Angel, Tom, Valles. Yes, it worked. Yeah, interesting, isn't it? Yeah, about that nerve thing. Vernette, Heather, Mom, Lisa, yeah, okay, going through Steve, Tom, Tim. Yeah, I'll instant message this to some people if you guys want to see the whole thing again. It's a long one, but Denise, and I'm just trying to get through the rest of these guys. Chris, Nelson, I hope I helped out, bro. I remember chatting with you. Yeah, let's see. Dennis, Daly, Ryan, you guys. Thanks, guys, for hopping on. Really appreciate your time. Yeah, if you got, yeah, okay, hang on a minute. Where is this? We got some more going on here. Hard copy available. That's a good question, Mom. Hopefully in no more than 2 weeks. Digital will be done in a week, but hopefully the hard copy won't be more than 2 weeks. So pretty excited. Yeah. Anybody got any questions? Any last minute questions? I think there's only just a couple people on here, but last minute questions I'll be here for, as long as you guys got them. And if not, we'll talk later. I'll do maybe a quick blurb review tomorrow about this stuff. Any questions? Nope. All right, guys. Take care. Glad to be helpful. And hopefully I'll be able to help you guys keep running and hit the ground running. So God bless you guys.